My name's Catherine, and with Swoosh English, we're going to be doing a series of videos looking at the occupational English test, specifically for medical reasons such as nursing. And today we're going to be starting with looking at one of the subtests involved in this OET exam, with an introduction to the speaking exam. So, this video, we will be breaking down the speaking subtest into its different parts and explaining how to do them. We're explaining how to approach the task, the necessary skills and abilities you will need. We will go through the marking criteria so that you fully understand what the examiners will be looking for, and we'll also give you some overall tips on how to complete the speaking subtest. So, let's first of all start off by looking at what the speaking subtest is. So, it will be a total time of approximately 20 minutes, and within those 20 minutes you will have to perform 2 different role plays with the interlocutor in the room playing the different parts. Now, these are face-to-face role plays. You as the candidate will always be the health practitioner in your normal medical role, and the examiner may play a variety of roles such as a patient, a relative of a patient, a carer, or another medical professional. There will also be 2 role plays about different situations, so this gives you the chance to show off both your medical knowledge, but more than anything, your English ability to discuss, negotiate, and clarify things in 2 different situations, so it does give you the chance to show a broad range of skills. You will always be given a role play card before you begin. This will explain the situation and what you are expected to do. Now, you do have 2 to 3 minutes to study the card, and it is vitally important that you understand what the situation and the task is. And also, if you have any questions or misunderstandings about it, please do use this time to ask questions and clarify what you are expected to do in the actual role play. And it will always be based on situations that you will be expected to be able to deal with in your role as a healthcare professional. So there may be a variety of different roles. You may be expected to deal with a patient and explain their condition. This patient may be of any age, gender, maybe they're upset or confused, as that may happen in real life. You may have to deal with a patient's relative who again may be angry about something or argumentative about something. You may have to explain things in non-medical jargon in easy language so that a layperson will understand it and ask or answer questions. Or it could be another carer or medical professional, in which case you will need to use the correct medical jargon. Okay, so let's take a look at what you are assessed on. So for the speaking subtest, there are 5 criteria you will be marked on: overall communicative effectiveness, intelligibility, fluency, appropriateness, and resources of grammar and expression. Now, these are all equally important as they are equally weighted for marks, and in order to gain a grade B in this, you will have to have a high level of English and score highly in all 5 of these different criteria. Okay, let's take a moment and look at these individually and see what you are expected to do for each one. So, for overall communicative effectiveness, this essentially is saying, are you an effective communicator? Is it easy to understand you? Can you state things clearly? Can you deal with the normal difficulties that might arise when speaking with people in English about a certain medical situation? In order to score a high level in overall communicative effectiveness, you are expected to be able to interact meaningfully with the patient, the carer, or the relative. You will need to understand the situation and be able to communicate coherently and concisely what the problem is, what the course of action is going to be, and you must also use appropriate medical terms, but these may have to be explained or clarified to the patients or relatives, as they may not understand these. You'll also have to be active in maintaining the conversation. It's not just a presentation where you speak. You will have to ask and answer questions, respond to what they've said, maybe negotiate, discuss, and also be aware of whether they're upset, whether they're angry, whether there is a problem, and you will have to deal with those accordingly. Okay, number 2 was intelligibility. This is perhaps quite straightforward. It's in how easy it is to understand you and how clear you are in getting your message across. So this is really focusing on how easy you are to understand in terms of pronunciation, intonation, and stress in sentences and words. Now, no one's expecting you to sound like a native speaker, but in English it is very important to have clear pronunciation, as the slight difference in pronunciation can change the meaning of the word. For instance, let's take the word worry. Are we saying worry, worries, worried, worrying? These all change the meaning of what you're actually saying, so pronunciation is essential. Equally, for the past simple, we would just add the ed sound, but it's very important to clearly pronounce that, or you may get confused about whether you're speaking in the present or the past, which obviously, when you're discussing medical problems, is essential to be incredibly clear and get your message across with clarity. Individual word stress and sound stress is also very important, as we do have some letters that can sound very similar. For instance, are you talking about a bill that needs to be paid or a pill that needs to be taken? So individual letter stress, individual word stress, and also sentence intonation and stress. We do speak very much with a rise and a fall, whether we're asking questions, making a list, making suggestions. So your pronunciation really does affect how easy you are to understand and how effective a communicator you are. Okay, number 3 is fluency, which essentially is, are you able to speak at length? Are you hesitating too much and grasping for words? Or are you able to carry on and continue a conversation without undue hesitation? So, a very good candidate will be able to maintain the flow of conversation without any undue hesitation. You won't have to stop and try and search for a word. You'll be able to speak quite naturally and clearly. And you'll be also able to maintain the conversation naturally and without any major problems stopping you. It's also important to avoid repeating yourself. If you're asked to clarify yourself by maybe a patient who doesn't understand a medical term, you will need to be able to use different words and explain and express yourself in different ways. Okay, number 4 of these criteria is appropriateness. As it simply states, how appropriate is the language you are using to express yourself. This can cover both language, register, and tone. Let's start with register. This depends on who you are speaking to. If it's another medical professional, you would speak with medical jargon involved, maybe quite formal language, it'll be absolutely fine. However, if you're speaking to a patient, especially one who maybe is older or younger, or is upset by the situation, you may have to explain and clarify medical terms or situations. In this case, you'll need to use different words to explain what you mean. We will also have to use appropriate tone. Obviously, if we're addressing relatives of a patient who is very unwell, you will have to moderate your tone and be able to deal with people in an appropriate and considerate manner. Okay, and our last one, obviously, is our resources of grammar and expression. Now, while the most important thing I would always say in the speaking exam is really to be an overall effective communicator, your grammar is very important, as it can affect your meaning and the way you come across. So, a strong candidate at this level will be able to use a wide range of grammatical range and structure in order to really be understood. There shouldn't be any confusion about whether you're speaking in the present, the past, or the future. And it should be very clear what message you are trying to get across. So there should always be correct use of articles. For instance, are you saying a pill, the specific pill? Is it a number of pills? There should be correct pronoun usage. It makes a huge difference whether you're talking about he or she or they. Who are you talking about? And there should be no need to omit words or massive amount of repetition. You should have the flexibility and the range of language, expressions, and grammatical structures to really get your message across clearly and as precisely as the situation demands. Okay, so we will look in more detail at all of these 5, but do really look at the 5 things you are marked on, as it will make it easier for you to improve. So let's have a look at an example role play that you might be expected to do. Location is the medical centre. The patient, you are speaking to a 56-year-old man who has come to talk to you about his snoring. He is slightly overweight, and throughout the consultation he looks very uncomfortable and only gives very short answers or nods his head. Your task is to take a relevant history of the patient's condition and to explain your preliminary diagnosis of obstructive sleep apnea, or OSA. Now remember, this would be your task card. You do get those 2 to 3 minutes to look, to think, and to clarify any misunderstandings you might have. So take a couple of minutes to read through and maybe make some notes or think about what you are going to have to say and the kind of language you're going to have to be using. Also think about the patient and the extra information you are given. So why might he be uncomfortable and how would that change the way you approach this task? And only give short answers or nods his head. It's very important to think, has he understood it? Do you maybe need to explain any of the medical jargon? And how you would deal with him. Do take note of the actual task and what you are expected to do, and then we'll move on. So, in your actual role play with the interlocutor playing the part of the patient, you will have to explain the causes of snoring. This might be the symptoms such as frequent need for urination at night, mood changes including loss of libido, feeling the need to nap during the day. You'll also have to outline some of the causes of OSA, such as obesity, alcohol, use of sedative medication, an underactive thyroid gland, shape and size of jaw. And you have to explain what you want the patient to do next. So maybe a sleep study to confirm the diagnosis, and then talking about lifestyle changes to make, such as avoiding alcohol and sedatives in the evening, and losing weight. And do remember, in this role play, you'll be talking directly to the patient who is, as it states, uncomfortable. So you do need to be considerate. You do need to be quite polite and diplomatic when talking about maybe the obesity issue or the alcohol issue. And above all, you do need to make sure that the patient understands you. So by asking simple questions or discussing problems, and also not overusing medical jargon. Try and use layperson speech to simplify and explain the situation. Okay, so let's look back at the main things you have to do in your speaking subtest. Number 1 is when you get that role card, really do make sure that you understand the task. You have 2 to 3 minutes to read, to think, and to ask questions, so do use that time. If you're unsure of anything, use the preparation time. The interlocutor is there to help you. So, always make sure you've understood the task, the situation, and who you are talking to. And remember, above all, communication is key. So we have gone through those 5 different criteria for marking, but the main point of this is to see how you perform in real-life medical situations. Can you cope with different people, different situations? Do you have the flexibility of language that allows you to communicate effectively? Okay, in the next videos, we'll be looking individually at separate sections and how to improve on your speaking subtest, but I hope this overview has helped clarify the exam for you a little bit. We'll be back very soon, but until then, goodbye.